Today we will talk about urinary tract infections in children. Urinary tract infection is a very common but a very commonly misdiagnosed problem in children. Now, when the child is young, it is not possible for the child to express that he or she has burning while passing urine or it hurts while passing urine. So it has to be objectively assessed whether the child is having a urinary problem or not. Sometimes in infancy, children with recurrent urinary problems may not present with the classical urinary symptoms, but they may have issues which are not related with the urinary tract, like having recurrent fever, recurrent gastroenteritis, weight loss, and failure to thrive or failure to gain weight. It is only when these children are positively looked for that urinary tract infection is diagnosed. So, in a child who is less than 2 years and is having on and off fever, on and off problems with gastroenteritis or poor weight gain, it is mandatory that a urine examination is done in order to make sure that the child is not suffering from urinary tract infection. In kids who are older than 2 years or who are able to express themselves, they may present with problems of burning while passing urine or having on and off tendency or on and off urgency to pass urine. In these kids, a urine routine and a urine culture examination is a must in order to diagnose urinary tract infections. Starting antibiotics without getting a urine routine and a urine culture, just thinking that the child has urinary tract infection, should not be done. Any child who is less than 2 years and has been diagnosed to have a urinary tract infection needs a basic ultrasound scan in order to make sure that the child's urinary system does not have any obstruction or any abnormal dilatation. If the ultrasound scan shows any issues in the urinary tract, then further investigations may be necessary to be done. In girls, sometimes constipation may be a very major cause of recurrent urinary tract infection, and hence if a girl has had recurrent urinary infections with normal investigations, then we need to make sure that she is not constipated. For boys having recurrent urinary tract infections, sometimes the pediatric surgeon may advise the child to undergo a circumcision in order to prevent him from having further UTIs.